This is Dr. Andrea Hesser. She's going to do the care of the neonate and then followed by a backstage pass on frozen semen. All right.
Hi guys. We just got all of this set up. I'm sorry for the delay. I know we're not actually that late. We're about 5 minutes, but I promise we'll get through it all.
All right.
So thanks for the introduction. I can kind of talk through, I've got a little bit of an introduction slide so that you guys can kind of see where I come from and where my background is, that sort of thing.
All right.
Oh, thank you. So let me make sure that my mic is in a good spot. Yes, I think so. Thank you.
I'm going to go ahead and close these doors.
All right, so good morning, everybody. We're going to talk today about neonatal care. So initially we were going to talk about neonatal care for the first couple of hours. I know the times kind of got shuffled around a little bit, so we'll be here for 2.5 hours total. I'm going to give you a break, and you're not going to make me sad if you guys have other commitments, if you've got a heart appointment, or if you need to walk your dogs. I will not be offended. And I will say before I get started, I want to credit Paul Investor is where I stole a lot of puppy pictures, and I just wanted to make sure you guys knew that because I am stealing and she's not here. So, all right, so as far as my background, I am a veterinarian. I practice in Texas. I'm also licensed up in Kansas up here as well as Oklahoma. I'm a boarded theriogenologist, which means I am a specialist in reproduction in veterinary medicine. So I went through and got boards done and all of that jazz. I was actually one of the AKC residents out in California when that program was up and running. So I was at UC Davis for my residency. Oklahoma State was where I did all my original schooling. And then I also have been teaching a little bit at OSU since being done with my residency and having a little bit of freedom. I also practice in both general practice and emergency practice on top of freezing semen, which you guys will see me in the booth that we will have set up. I know you guys haven't seen it yet because it's not here yet because I just got here, right? So we'll set that up this afternoon, but we'll be here the rest of the week doing semen freezing and thyroids and dentition and things like that. So I do consult for VIN, which is a veterinary group, basically vets talking to other vets that have kind of expert level questions. So say they have a case that they saw and they don't know what to do with it, then they post and ask me what to do with it. And then we kind of help them to figure out what to do with their case. Some of the things I consult on are neonatal cases. So that, as well as, I should say too, I'm actually published in an emergency text on neonatology. So I am very interested in neonates. Obviously, when you work with breeders and you breed dogs as a theriogenologist, we also deal with the puppies. So we get a lot of hands-on experience that way. And a lot of it is kind of learned as you go. But some of it is kind of pearls that I've stolen from all sorts of different people along the way. So I'm one of you guys too, just so you know. I know not everybody here knows me. The people from the Texas, Oklahoma area probably have seen me before. I've been showing for a long time. I think it's something like 20 years. I know I seem young, but I've been doing it for a long time. And I know your interests and motivations and things, which really helps. And I've also bred some litters. So this is actually not a bitch that I owned, but a bitch that I whelped for a friend. Just one of those scenarios where she didn't have the right setup and I had the right amount of time and could facilitate it for her. So have a lot of experience from that perspective too. So we're going to break this into kind of two sections as far as the neonates go. So initially we're going to talk about the first 24 hours. So that's kind of the first part of the talk. Usually that's the highest time frame of having death with puppies, right? So you guys that have whelp litters, a lot of times it's, the immediately stressed puppy that's the one that we end up losing. We can also lose them, later on in weeks, but more common that way. And then the second part of this talk will be on the latter part. A lot of this talk will be, some of it is a little bit on resuscitation and just approaches and thoughts of how to go about things. Some of it we're going to go through and do congenital defects, so things that could come out and look at you whenever you are whelping puppies. Sometimes they are things that we can't sustain with life, so things that we would euthanize puppies about. Some are things that we can actually address. And then we're going to talk about what a normal neonate should look like. So things like their vitals, so what their temperature should be, how they should be acting, their reflexes, those sorts of things. We'll also talk about injuries that can happen either from husbandry or from mom. And also we'll talk a little bit about colostrum. So that's going to be within the first 24 hours. So I figured that'd be a good place to stick that. All right, so big factor in how things go with your puppies has to do with how they come out. So natural birth has a certain degree of mortality associated with it. That's totally normal. It does not make you a bad breeder for not having, reached for oxytocin sooner. And like, I know you can just beat yourself up if you have puppies that die that don't seem to have a reason and they're perfectly normal puppies. That is just part of getting through their birth process. Same thing with humans, unfortunately. Sometimes the same types of things happen. So we don't always know why. I talk to people about, we have 2 horns, and I think sometimes maybe one horn is making a lot of progress, and they keep beating the other side, and there's 2 that try to come, and then one gets past, and it's still the same side. It keeps getting past, keeps getting past. This guy's trying to go, but he just can't kind of connect. So I think sometimes that's what's happening. We can't prove it, but that's my secret theory. So elective C-sections, we have very few deaths with elective C-sections outside of things that have congenital defects that we want to euthanize over. So the reality is well-timed elective sections, we do lose less puppies. Personally, I am not a big proponent myself of doing electives because I think that it's important for them to know what they're doing. I also think it's good that your bitch can free whelp. One of my original breeds was Rottweilers. And one of my mentors was very pro, one puppy will pay for that C-section. I don't care, we're doing a surgical on every dog and we're gonna do a C-section on every dog. Do we need to do that? Should we be doing that? I think you can debate it. I don't think it's wrong to have one opinion or another. I just think I like to know that they can do the job from start to finish themselves. It's nice to be able to see that. Now, emergencies obviously depends on the state of the emergency, how urgent it was, how long you had to wait, how long you had to drive. I think sometimes it's how long you had been instructed or guided to wait based on either your vet or another outside person. Anybody hear of a whelping pause? I'm sure you guys have all heard the term whelping pause. I hate that word. It just means they waited a while. It usually means their calcium was low. Could be perfectly fine. A lot of bitches will, take a nap and it's fine, and then they keep whelping and they do okay. But there are a lot of theriogenologists that are now suggesting 1 hour between puppies. I think that's pushing a little bit as far as like when to or urgently rush in and start doing something. But we're just kind of grabbing numbers based on experience out of the air. And in your program, it might work well to let them take a rest, but just know, the longer she rests, the more likely she's going to fatigue, the more likely she's not going to be able to whelp the rest. So a stressed puppy, in our mind at the vet, it is a puppy with a heart rate of 180 or less. 160 or less is a surgical emergency. She needs to get on the table. 170, maybe they're just fluctuating and she's having a contraction. It's possible. 140 or less, we are lucky to get in there fast enough. Sometimes I know it seems like such a little change, but it's really tough sometimes if they're under like 160 to get in there quick enough. So you guys probably know a lot of these details. So this is going to be pretty basic for a little bit as far as resuscitation. I'm sure has everybody in here whelped or resuscitated a puppy at a labor? Okay, well, so not everybody. So there's pretty simple techniques. So basically we rub the puppy vigorously, we clear their airways. Those are the first 2 things we do. We use these little nasal syringes, bulb syringes that you use for human babies to get their noses clean. They come in different shapes and sizes. The littler they are, the more I like them usually, no matter how big the puppies are. These mucus traps, I just wanted to show this to you. So has anybody heard of these Dealy mucus traps or use them? So some of you guys use them. So basically what you do is it is a closed system where this is where you put your mouth, and then this is going to go into the puppy's nose, and this is not a continuous tube, so there's like just a big open space in here, so that you can create some subtle pressure. It's not like high pressure, but you can get that mucus out more effectively. So you can get it down in their little airways, you can put it in their nose. They're great. The thing that I will say is you can reuse these. There's a lot of hospitals that clean them in between and like just sterilize them, basically put them through an autoclave. You don't necessarily have to. I mean, you probably could wash them. Just be careful to make sure you get all the soap and you don't want any residue on there. just don't let them get full. So if you have a big litter and you use them from puppy to puppy to puppy and you have 14 puppies, if this is full, guess what happens? It's not good. So, stimulate, rub these puppies. The moms are not going to be nice to them. They pick them up and drop them on their heads and step all over them. And I mean, that's why they're up and around. I mean, some of them will come out and they are screaming and they are already latched onto the teat before they're out. But some of them, you know, she's going to mess around and lick them and be vigorous with them. Warm towels. So we, like at most clinics that I work at, we like to cycle the dryer all the time. So if the dryer is going, we have puppy towels in the dryer. There is a technician or an assistant that literally their whole job is just to walk the old towels that are dry back to the dryer, and then the new towels go back out onto the puppies, and we just cycle them as we need to. So naturally born puppies will resuscitate easier generally than C-section puppies. I would say this is absolutely true for Dobermans, not necessarily true for all breeds. C-section puppies will have some level of anesthesia generally. Some surgeons are really fast and they can really get in there to the point where there's not a whole lot. I can tell you the people that use propofol protocols exclusively, like I don't know if some of you guys are aware of what choices your veterinarians are making, but the protocols where they haven't had any gas inhalant, they're just getting oxygen and they're just getting propofol, sometimes those puppies are so vigorous that I have to be aware so that they don't climb away from my uterus while I'm trying to get them clean and tied off so that I can hand them to somebody. Like they can be really active. I think the other thing that can really influence activity is oxygen. So if the bitch gets oxygen before she goes into surgery, it can really help with vigorousness. So let's see. So injectable meds, for the most part, we can reverse. So that several of the pre-medications that we would use, a lot of people will use something like hydromorphone, butorphanol, most opiate type classes, because we have to be kind of careful about a lot of the other ones. Opiates are fine for neonates, but they can make them sleepy. So if they are sleepy and the whole litter seems kind of sleepy, well, we might reverse them with naloxone if we think that there's a problem with that. Anybody heard of APGAR scoring or have a clinic that does or do APGARs on your litters? Looks like there's a couple of people. So this is a scoring system. This is actually a human scoring system on the bottom, just in case you were wondering why. I guess it's kind of similar, but grimace we wouldn't be able to really see, right? So APGAR is an acronym for appearance, pulse, grimace, activity, and respiration. So what you want is for all of your puppies to fall in the 2 category. We actually converted this and made this into a dog scoring system as well. They've studied this a lot in humans. Obviously, initially, I think this was in the 70s or 80s that this woman, her last name was actually APGAR, developed this system. I think she was a neonatal nurse. And she just realized that above a certain score, so above 7, if they score higher than 7, that means that they have very high likelihood to survive. A 5 or a 6 is kind of mid-range, and below a 5 is a concerning patient. So this is the puppy and kitten version. So it adjusts things a little bit. We just changed some of the parameters, but basically we want their heart rates to be fast. We want them to be crying and breathing regularly. We want them to be vigorous. They should be crawling away from you. They should have active motion as far as like if you set them on the table, they should try to crawl. And they should have a pink mucous membrane. So some puppies, I know some puppies can be born with a lot of pigment, so it can be kind of tough, but most of the time they're born with enough kind of pink pigment that you can kind of see what you're looking at as far as that goes. But again, 7 to 10, no distress. So 7 is totally normal if you have a puppy that's a 7. Now, if you're doing a C-section, a lot of, like Auburn University uses this on all of their litters. For example, they are the only university I know that does this, but they have tons of students, and they'll say, okay, you get red puppy, you get orange puppy, you get yellow puppy, you get green puppy. As those puppies come out, those students are given a stopwatch, and they say, okay, at 1 minute, do an APGAR. At 5 minutes, do an APGAR. At 30 minutes, do an APGAR. And then they provide all of that data for their owners, so they can really know what was going on. They might be different from 1 to 5 minutes. So like a C-section puppy might be a lot different from 1 to 5 minutes. All right, so if they are not resuscitating well, the constant rotating towels trick is really helpful. I think that's very underestimated. It's amazing how many very busy reproductive practices I have been that have very cold puppies. And they don't nurse as well when they're cold. So they're not as busy, they're not as active. Makes me more nervous to send them home. There is a flow-by mask that, I don't know if some of you guys have spider carts or have some kind of an oxygen cart, but you can get a little mask or something small that can kind of go over the nose to help deliver oxygen if you have a stressed puppy. I think it never hurts to have oxygen flowing by. Acupuncture, so anybody used this point on these puppies before? So this is called GV26. It is a stimulatory point for the cardiovascular and respiratory system, so it will help all of the above. We think it works because that is the first place mom goes to lick. That's where she stimulates. That's where she affects those puppies immediately. They go to clear their airways, so that's why we think it works. As to exactly how acupuncture works, it's amazing. I am a totally believer in it. If you haven't had an experience with a dog and seen the power that it has, if you put this type of pressure point in an adult dog, they will light up and bite you. They are like super stimulated by it. So it's just one of those kind of safety points for CPR reasons for all ages. You can do CPR, teeny tiny puffs. And when I mean teeny tiny puffs, their lungs are tiny. So if you do more than just like a tiny little puff of air, if you're closing over the nose, just know that you can overinflate their lungs and actually burst the tissue. So just be very careful. As far as the cardiac part of that, it's just going to be little pinches from the side. So there's no like over the top. It's very subtle. We can use oral medications and catheter systems and other things to deliver drugs. If we want to deliver, say, epinephrine or something like that, it is possible to do so. At that stage, you're probably have left your home and you're probably somewhere else, or I hate to say it, a lot of these things that we'll talk about might be applicable for C-section puppies, but might not be something that you can get to fast enough for a puppy that you have at home. So just FYI, intraosseous catheters, the IO catheters. So this is the pelvis and the femur on a dog or a puppy. So this is a catheter. That's the needle right here. So basically that's the site that I like to use. I don't like to use this one up top. I think it's too challenging. This one, we basically just put that needle just barely into the bone right there. It seems really awful, but there's no way to get an IV catheter, right? So if we want to get intravenous drugs or if we want drugs to work quickly, that's our best bet. The same thing we use the same things for things like exotics, really tiny animals. Sometimes this is all we have because we can't get a catheter in them. If we could get a catheter in these, that's what we would use, right? A regular catheter, an IV catheter, but we just don't have the access points. All right, so anybody seen The Greatest Showman? So all the like fun things and pictures, this is just a fair warning. There's gonna be some graphic pictures of puppies with weird deformities and things. So just bear with us. If you're a squeamish person, you wanna take a little walk, we can grab you from the aisle. Figure you guys are not. Some of them are okay. So these are facial abnormalities. So these are basically modified cleft palates, but they're not cleft palates. So this puppy just has a cleft lip, essentially, on both sides. So it's a little bit interesting. It'd be really hard to fix surgically, but can be done. I think the question is can this puppy suckle effectively? And if it can't, then we'll need to supplement it. But this is absolutely fixable. This guy, I think he's got more going on. You can see his nasal passages are a little bit off, which is not good. It's hard to reconstruct that sort of thing. So more on the nasal cleft. So there's a nasal cleft right here. And then you can see the palate is a little bit weird, but there's no cleft here. So there's no problem with this puppy. This puppy probably will suckle perfectly. We see a lot of these actually sometimes in show-bred dogs. That totally normal puppy can't be a show dog. It's not going to be a dog you go forward with, but it can be somebody's pet just fine. I know, this one's kind of sad. So this is basically exposed brain. So we don't know why this happens. It's almost like a cyclopoid, so like a cyclops effect is the best way to say it. Yeah, so anyhow, it's not something, obviously these puppies are not born live. They're not viable. Hydrocephalus will be born alive usually. It's hard to find pictures of this. I don't really think to take pictures because I hate to say it, we see enough like Chihuahuas and things. They all look hydrocephalus, right? Like this is probably normal and it just was labeled as one. Usually you can kind of see their eyes kind of get wide and kind of look out to the side almost is one way to kind of distinguish it. Neurologic defects. So I know this looks like trauma, right? It looks like somebody took a bite out of them, but this is actually things that they can be born with. So this is spina bifida. This is a head up here and a tail down here. And it basically just was their spine just didn't close. So these are not going to, these might be born alive, but these are going to be ones that we're not going to recommend trying to save because they are going to end up getting serious infections and dying. Microphthalmia, this is something I think not super common in Dobermans. I would say based on the position and the way that we select them for their headpiece, I would think that this is not impossible that it is out there to some extent because, you know, they're deep set, very tightly made heads. It's usually things like collies that have this type of problem. So they'll be born, so this puppy, when it was born, you probably couldn't tell. But once it was a couple weeks, this is probably 4 weeks old, it's got a totally normal eye, and then this side is just kind of collapsed, so there's like almost nothing there. They can come in a variety of shapes and sizes, I guess you can say. Sometimes there's a teeny tiny globe, sometimes there's not. Cleft palates, I'm sure you guys have all probably been aware of this. So I showed you a normal one just so you could see what a normal palate looks like. So you can see all the way down, you can see no division between the palate, and then you can see this darker line in here. This one's a little bit more subtle. So at the top, if you hadn't opened this puppy's mouth real wide, you might have thought he was okay. Pen lights are your friends. So get like a cheap pen light from, you know, Amazon. If you don't have one, I think those can really help you be able to visualize. You can try to use your like phone light too. I think phone lights they're bright and they're not the same type of light and it's not as directed, but it works pretty well. This is a common positional defect, so this is actually not a problem for these puppies. Has anybody had these, people like to call them club-footed, but they're not really club feet. They just are stuck in a position in utero, and their joints kind of learn the wrong position. We can move their joints totally normally. So this puppy, you could flex his toes all the way forward and have his hock be faced normally. And you can see only 3 or 4 days later, this puppy is fine, totally normal. So we just position their feet kind of underneath them, help them with like kind of muscle memory, but we want to help them correct these. A lot of them will correct on their own, but I think it's just kind of simple like muscle memory. So you just kind of do like little flexion exercises with them. Most common, it can happen to any breed, but most common would be things like Frenchies. Frenchies like to have, they've got these little stubby legs and I don't know, we just tend to have everything happens to Frenchies, right? This is Atresia ani. Hopefully nobody has ever had a puppy with Atresia ani. This is a birth defect where they're born without the end of their GI tract. Obviously it's not good for life. There are people that have tried to fix these, not with good success. So I think I've heard of one ever that actually had anal tone or had some kind of a ability to use themselves in the back end. I think we can sometimes make them functional, but they're completely incontinent when we do. So not really good quality of life. And I think it's tough. Some of these puppies, you just, like cleft palates being an example. With my own litters, I euthanize cleft palates. There are plenty of breeders who opt to tube feed and support cleft palates and get surgeries done, because we do have the ability to do surgeries on those puppies now. 30 years ago, probably wasn't practical, but we actually can fix them now for the most part. I've also seen the train wreck cleft palate that had 8 surgeries and it still wasn't good. So, but if you have the positive experience in your, in your hands, then you're going to lean toward that direction. If you've had the negative one, you lean the other way. And I think that's kind of where I stand. These are kind of a no-brainer for me. It's unfortunate. This is one of those things we check for when you come in for like your tail docs, because if we're coming into dock tails, well, we're going to be looking at the back end there, but we do a full exam on all these types of points because you might not have noticed this. It's amazing. She's going to clean these puppies just like they're all the other litter mates. She doesn't know it doesn't have an anus. She's going to clean it. And a lot of these, if it's a female, well, they're going to be cleaning in the same area. You're not going to think twice to check for this sort of thing. and they'll be fine. Some of these puppies they'll be 4 to 6 weeks old if they haven't been into a vet, just be backed up with stool, and they'll get bloated and they're unhappy, and that's why they go to the vet, because their stomach hurts and it's big. It's amazing how they're on a liquid diet, so they don't accumulate a lot of stool when they're absorbing the fluid out of their stool. This is a water puppy. Not a big problem for your breed, but can happen to any breed. It is considered genetic in some, but basically this puppy will have, if you looked underneath its skin, it has a big layer of just, almost looks like gelatin. So we call them water puppies. It's not truly liquid. It's like edema that builds up in there. They also can have liquid in their chest, so fluid in their chest. That's usually why these are not sustainable with life. Obviously, this puppy is not normal, right? I mean, that puppy's not going to be able to function, even if it could breathe, could have a normal heartbeat. It's not going to be a happy puppy. So this is called gastroschisis. This is an issue where the intestines are born on the outside. This is probably one a lot of you guys have seen. Happens with fair regularity. I just wanted to let you guys know, so this is actually something that if it's caught in the right circumstances, it can be fixed if we can get things back inside. So I had a couple of examples. This one was pretty limited as far as how many intestine loops. It looks nice and red and angry, but it's everything was able to get back inside the belly and it looked pretty normal. I don't know if these will come across well. This is a Chihuahua puppy. You can look, I know it's not very good resolution, but if you look at how much intestines, this is the puppy's back legs right here. That whole bit of intestines had to get back in that belly. I really didn't think I was going to be able to do this one, but of course, this was on a holiday, C-section emergency, right? And I'm the only doctor there. So a lot of times if you're in a multi-doctor practice, if you have somebody comfortable that's not in surgery, that person can go right on to fix that puppy. The problem is when you're on holiday, you're the only one, right? So I had my technician basically get this puppy resuscitated to the point where it could breathe. And then after I got done closing the bitch, then I went and fixed this puppy, and we just tried to keep it warm, and then we put it back under gas to try to fix it. And I was able to close him. This is one I actually have had follow-up with. So I did his vaccines, and he's a show dog now. I told this owner, because we don't really follow these puppies. Are these genetic? We don't know. We think that they're just kind of like a fluke of nature, but we don't really know. So maybe this dog will be a good case study as far as what will happen. I'm actually waiting for them to breed. I think he's a couple years old, so they'll probably start using him if somebody's interested in using him. I just want to see what the incidence is from here, because I think that'll be really cool to be able to see. Because usually, what we used to do with these dogs, we used to just euthanize them. What are we going to do? And if mom whelps this puppy naturally, she's going to go mow right through that. This is going to be part of the umbilicus in her mind. She's going to go right through it. And there's no saving those. If that happens, it's going to be take your puppy to the vet, or if that puppy is not trying to die, it's going to die. That's just the reality. There was no good place to stick this. I know this is kind of a graphic picture too. So there's something called neonatal ophthalmia that can happen. It can happen at a couple days old. It can happen later. It is an acquired disease. It's basically an infection that goes underneath the eyelids. The only way to fix it is to open the eyelids. So I know it seems a little bit weird that we would open their eyes before their eyes should be open, but that's what we do. So we take like a little Q-tip and we just get a moistened Q-tip and just work the side until we work the eyes open and get all that pus out of there. We also like to send them home with meds when we do that. But I would say usually like 5 to 7 days. I just didn't have a good place to stick it. Okay, so now that we've done the weird things that you can see, we'll go to normal. So normal puppies usually have a pink or red appearance to their mucous membranes. Their temperatures are lower than you think. So I think the mistake, even amongst vets, is that puppies should be 100 degrees. They should not be 100 degrees. If they're 100 degrees, they're going to be pissed off. They are not going to be happy puppies. And it's not good for them, and they dehydrate easier if they're warm. We want them to be kind of in their normal range, but they can't regulate their body temperature. That's the reason why we do all the heat that we do in the whelping box. Pulses usually, depends on the breed, but usually somewhere 160 to 200 would be pretty normal for a resting puppy. And 15 to 30 on respiration. Some puppies, they'll have these funny like waves where they'll start breathing really heavily, and I think a lot of it's like that like twitchy sleep stuff. Same kind of thing. Sometimes they just get kind of into their development. Not necessarily a concern. We talked about palates. We definitely want to check the umbilicus, so always be looking at those umbilical cord areas, even if you handled it and everything at the time of. We want to just make sure they're not getting red or swollen, anything like that around the base. And then we talked about checking for an anus, and are they active? Are they happy? Simple stuff. So I know this looks a little bit strange, but so there's a righting response. If you pick a puppy up by the head, which is kind of what mom will do, right behind the head, they have a righting reflex that's natural just for them to want to turn over in the box. But the flexion and extension reflexes are just interesting to watch. They switch off from flexion, so they'll be kind of legs tucked and kind of curled into a ball, to this like, I'm flying, I'm Superman. And it happens overnight. So this will be 4 days, and then this will be 5 days. You should test it the next time you have your puppies. But this is what they're normally supposed to do. Birth weight. So don't worry if they don't gain in the first 24 hours. I know you guys that have been doing this a long time already know that. So that's not news. They can lose even in the first day. So they just have a lot of changes. They're figuring out what's going on. A lot of times it has to do with mom's milk too, so sometimes she doesn't have as much of a supply. And then from there, we expect them to gain every day. So I usually weigh twice a day. They're gonna gain between 5 and 10% of their body weight every day, which is gonna equate to something like doubling in the first week, and then doubling again from the first week to the second week. So those are all good things. So we're gonna talk a little bit, this is gonna be another one of those ooh-ah pictures moments, so bear with me. Some bitches get carried away. Some of them do things they're not supposed to do. They get too excited when the first puppy comes out, or they decide that their puppies are mice. Sometimes that happens. It's very important to watch your bitch after she has her litter. No matter how much she acts like she wants to be a mom, no matter how much she liked her last litter, calcium can do weird things to their body. Just postpartum things. I mean, I don't know if anybody, I personally don't know anybody who's had postpartum depression, but there's some weird stuff that your hormones can do. And it doesn't necessarily happen every time you're pregnant. It can happen just this time and not the next time, or it didn't happen last time and does happen this time. A lot of bitches will tolerate them because you ask them to. They really do. They know you're their boss. When you're there, that's what they're thinking. They think, okay, she wants me to lay down. She asked me to lay down. She asked me to lick this. She asked me to do all that. But whenever you let them do it on their own, sometimes they change. So this is an example. This is not gastroschisis, so it's not the same condition. This is a puppy where mom went for the cord and pulled and opened this puppy's abdomen. I don't know from the picture, I can't really tell if this is something fixable. Potentially it is. I mean, we have them every once in a while. We'll have an owner call and say that. It happens. It doesn't necessarily mean, if they just pulled on the cord, it doesn't necessarily mean that there's a problem, but obviously we need to close that abdomen and get them antibiotics and do some treatment. Sometimes they decide that they're mice, like I said. So some of these puppies, we can stitch them up, but sometimes this is just a lot on them to process, and sometimes they die if they have a lot of trauma. And sometimes it's when they're a little bit older. These puppies are not as young as the first ones, but yeah, this is German Shepherds, classic puppy. Mom attacks puppies. This breed just likes to eat their puppies, sometimes out of nowhere at 3 weeks old. They'll just come home to half of the puppies that they used to have. And it's crazy because they're great moms. They seem like they're great moms, and then something weird kicks into their body. But I actually borrowed this picture. This is a puppy that had a limb removed by a dam. So that will be a 3-legged dog. Maybe it'd be a happy 3-legged dog, but it's obviously not what we want. So I think monitoring is very important. How are we doing on time? Good. All right, so whelping box temperature. So I would say this box, so these box setups aren't my favorite in general. I don't like wood boxes, so I will say, just as a critique. These were just pulled off the internet, but this is, some puppies clustered around mom, some puppies are kind of bunched, some puppies are kind of climbing around. These puppies look very content. These puppies look like they're cold, right? They're all kind of huddled together, they're in one spot. I have a picture somewhere, I just couldn't find it, but it's like puppy over here, puppy over here, puppy over here. Well, those puppies are too hot, right? So they'll be your barometer in the box. You can really tell. And I'd rather them be, I'm not telling you to keep your puppies cold, but I think we do too much with heat. Sometimes we make the bitch not want to be in the box. And I think the reason that these guys nurse aggressively sometimes and want to be close to mom is because they need the warmth. So they want her warmth. And so they have better bonding and they've got better kind of connection with mom. I think maybe they nurse better. And that's just my hypothesis, but. All right, be careful with what you clean with in the box. So on those boxes that you can really sterilize, it's great. This is an example of like a chemical burn. So this puppy was put back onto a surface. They didn't realize that all the sterilant wasn't off. This can also happen as a surface burn for heat sources. So if you use a plate or something solid, steam, if anybody has ever burnt themselves in the oven with maybe a dish towel that wasn't dry and you use that to pull the pan out of the oven, it will burn you so much faster if it's moist. So puppies are moist, right? They're peeing, mom's licking them, the bedding gets moist. So if you are using plates, just be very careful. Doesn't mean you can't use them. I mean, obviously, if you're experienced with them and you've used them for a long time, you've kind of probably already figured those things out, but just something to be aware of. Every heat source has its things. I mean, the can lights can burn your house down. The heating pads get scrunched up and they're not, diffusing enough heat. There's no perfect heating system, perhaps maybe an incubator, but again, we can't put mom in the incubator, right? All right, so lack of monitoring we're going to talk about as we go on here. So we're going to talk about a little bit in the 1 to 2 week old lecture. But basically, as soon as a puppy is distressed, especially in that first 24 hours, if that puppy is upset, be very aware of it. I think they are going to be your clue to what's going on. If they're upset, there's probably something wrong. Now, it could be because they're too warm or too hot or too cold or something like that's going on. Crush injuries. I know Doberman bitches are not mastiffs, so it's not the same game as the Dane breeder that sleeps in their box for 2 weeks. I don't know if some of you guys do. If you do, good on you. Cots are great in your whelping room, at least for a little while. It can happen late in life. I actually had one of my Ridgeback bitches was one that had at 3 weeks she almost crushed a puppy, and she's a 60-pound bitch. I mean, she's not a big bitch, and they were 4-pound puppies or something like that, fat puppies. But she just laid in the right way. She's tired. She's not thinking. She didn't respond, she didn't wake up, and thankfully we were there to go pull her over, and it was 2 a.m, always is, right? Okay, so we're gonna talk a little bit about colostrum. So colostrum is the first milk. Basically, we want them to drink that first milk within the first 12 hours of their life. She will make colostrum longer than that. So she will make colostrum for her entire whelp, right? And then she usually will make it for a day or two. So you might notice that if you've ever expressed milk from your bitch and you can see the color difference kind of change after a day or two, they actually make colostrum longer than we anticipate they do, but the puppies can't absorb it after a certain point. Still great milk, but they just can't absorb it after that point. So gut closure prevents absorption. So gut closure can happen just because of time, so that kind of 12 to 24 hour range. We used to say 24, 12 is really better practice if you can, but 24 is still potentially helpful. The other thing that will cause gut closure is giving milk. So if you supplement puppies, you are closing their gut, potentially. I know it's a little bit backwards because sometimes we tube feed puppies when we're at C-section. If we have puppies that won't nurse, sometimes we tube feed them before we go home. But if we do that, I always talk to my owners about doing something supplemental relating to colostrum because likely we have affected their ability to absorb things. So something interesting that, I don't know if you guys know Joni Freshman. I was just at a lecture of hers at a conference. Joni she practices, I think, she's in Colorado now. I think she used to be on the East Coast. Some of you guys might be, I don't know if you guys know her previous clients, but she mentioned there's actually a study recently that said that there's different levels of immunoglobulin, so different amounts of that colostrum IgG that like we want them to absorb in different teats. So one teat might have 20% the amount that another one does. So if you let those puppies sit on one, which they like to do, right? They pick one and those are the ones they like to be on. But if you can interrupt that and if you can get them to nurse different ones, it's recommended to switch it up and make each puppy make the rounds on 4 different teats at some point during that period. Now I realize that's a lot to manage because if you have a litter of 10 puppies, how in the heck are you going to manage that? I don't know. I don't know the answer, but I think it's interesting that they just figured that out. Yeah.
And so if you do supplement right after they're born, would it be better to just do clear liquids, or is anything going to shut down the gut?
So I think it's milk specifically that will shut down the gut. So the question was, will liquids of any kind shut down the gut? So if you tubed them Pedialyte, but Pedialyte is not going to help them nutritionally to kind of thrive. It might help rehydrate them and might give them electrolytes, but it's going to be a little bit of a different scenario. So I would say the best way to approach it, and we'll talk a little bit about options for supplementation, but I would tube them if they need it. If they need the milk, they need the milk. And if you don't have a colostrum backup, you don't. It's one of those things you got to either have it frozen in your freezer or you don't have it and you got to work with what you got. The other thing we can, which I'll talk to you about, we can tube them serum. So the fresh frozen plasma or serum, say from that bitch, if you're at the office, or if you have another dog, usually we use like some of the boys that live in your house. So they're exposed to the same things that the bitch is going to be exposed to. They probably have similar kind of vaccine histories or similar prevalences with other things in your environment. And they're, as males, they don't have, obviously they're not pregnant or recently pregnant or anemic. Your bitch is probably anemic because she just had her litter, and that's pretty normal for a pregnant animal to be a little bit anemic. So usually we'll draw blood from housemate and then tube those puppies with the housemate's serum, or if you have fresh frozen plasma. So if you happen to keep plasma at your house, great. If your vet keeps plasma, great. Those work too. So we might need alternative treatments if a puppy isn't thriving. We might need to supplement colostrum if the dam hasn't come into milk. So that doesn't happen very often to Dobermans in my experience. They tend to like to be milk factories and have false pregnancies when they shouldn't and all sorts of things like that. You guys, I'm sure, are enjoying that this week. Anybody have a bitch that's showing that's just entered a false pregnancy and, probably, yeah. So sometimes, it's not something we like to think of, but sometimes the dam is ill or the dam is in the ICU. Maybe the dam died. Maybe something happened. So sometimes, pregnancy is not benign, and sometimes just things happen that we can't explain. And so we want to just make sure that we can supplement them if she's not around to do so. And I should say too, I'm not a big fan. I know it's great if you've got a friend that has a bitch that's whelping on the exact same day and you're in the office together and you're having a C-section party and then your bitch dies, or, I hate to say that, but if that happens, maybe the option is to cross foster and let those puppies nurse on the other dam. But just be careful. Diseases are transmittable. Other bitches can potentially decide your puppies are snacks. You're putting a lot of trust in that. And I just think it's good to be, it's very gracious for people to offer that. I just think you got to know what you're choosing to do and be very careful when you do it. It can make a lot of friends not friends anymore. So options for colostrum. So you can bank colostrum. So if you have a bitch that has a singleton and she has worlds of milk because she had a litter of 10 last time and she has great memory and she is just full of milk. Well, you can, for the first 24, 48 hours, just basically milk her. So you can express her glands into, I use like those little conical tubes, which is, semen tubes, right? That's what I use because that's what I have. But you can use like a plastic baggie. You can use all sorts of things. Some bitches are really easy to strip their milk. Some are not. So if you feel like you're like sitting there for 2 days trying to do this, maybe you just pick up some fresh frozen plasma because you probably expended more energy than it was to just buy that FFP. This FFP, so you can buy this. There are suppliers that will sell directly to breeders. So that's something that is available. You also, a lot of veterinarians will keep it in their freezer. They might have it for other reasons. So they might not think about it for puppies, but if you bring it up, they might be able to give you part of that bag for puppies, or sell you the bag. And we can use this either orally, so we can tube this, or we can use serum, or we can use the FFP or serum that we've banked sub-Q. So again, we can use like your stud dog that's laying around, you know, on the couch at home, and he just wants to come to the vet for a blood draw, big blood draw, and then we spin down his serum and pull off the serum, and then we're able to use that to help replace this deficit for these puppies. Usually when we're doing oral, so we're talking right away. We're talking first meal, same time frame. When we're doing sub-Q, it's usually a day or two after birth. So there's not a perfect, I mean, you could do sub-Q immediately after birth, but we usually wait a couple of days and give the rest of the system the benefit of the doubt. Powdered colostrum. So if you look at like colostrum powder, a lot of people think that this is a great idea. It's not canine colostrum. It's not human colostrum. It's bovine colostrum. Won't work for us. So cows get totally different diseases. We're essentially benefiting from viral and bacterial, but mostly viral things is what your plasma or serum is going to be providing that puppy. Those types of pathways are important for viruses specifically. Okay, I think we're doing good on time, you guys. So, yes.
On the serum or the FFP?
Yes.
How much are you supposed to administer at one time? How many times?
Good question. So the question is how much FFP do we give if we're giving oral or sub-Q? Oral, there's not a lot of rules, but I usually stick to the sub-Q rules. It is 10 mils per pound of puppy total. So you're obviously not going to give that in one dose. So 10 mils under the skin of a newborn puppy would be a lot of fluid, and you might get discomfort. Puppy might be, I worry about puppies getting like too much fluid too quickly. So it's like more than we would give if we were giving fluid sub-Q. Usually I'll break it up over 12 hours if I'm doing that sub-Q poke. And so I'll do like, you know, if it's a 1 pound puppy, I'll do 5 and 5. As my doses or something like that. Just with your normal, like just how you'd administer plasma light or, you know, LRS, so whatever sub-Q fluids you use if you have some at home. And the oral is much easier to administer because you don't have to use quite as much. The timeline is easier because, you know, if you tube 10 mils in some puppies, if you have a 10-ounce puppy, well, you can just tube 10 mils of fluid, and that's basically like a fluid meal. So it would be like if he was tubed colostrum or milk, well, that's how much he'd be taking anyway. So usually we can get by with the oral a little bit easier, but it doesn't hurt to do more. I would just say be aware of you're displacing his interest in nursing, and you're displacing, I guess, if he's not nursing, kind of depends on the scenario, right? Because if mom isn't around, we still want him to have, you know, the fat, the glucose, all the other components, or I guess lactose, all the other components that are in the milk. That's why like Pedialyte, well, it's hydration, but it's not going to give you any nutrients. So I think good to keep that in mind. Don't get overzealous. If we have just banked colostrum, you tube that, or you give that colostrum, bottle feed it, tube it, however you want to give it, as much as you want in that time frame. I mean, if you've got actual colostrum, that's great. If you don't, I think the serum we just have to be a little more limited with. So, anybody else have any burning questions on these guys before we go to neonates first couple weeks? This is going to be a little bit more brief. That one, we had a lot of there's just lots of things that happen when you're born, right? First few weeks, it's kind of an extension of what we already talked about to some extent. So we'll review some of the same things, but mostly what we're going to talk about is how to recognize early signs of illness and what a fading puppy is, what herpes virus is, how we manage those things. And I didn't include any pictures, don't worry, I know I'm already done with the gore. But importance of necropsy and diagnosing some of these guys. All right, so you've already seen this slide, right? This is a very important slide. If you haven't already screenshotted this slide, I recommend it. So this is review, again, birth weight, super important to be monitoring. We want them to be gaining. They should be doubling their weight within the first week of life and then double their weight again to second week. I usually log twice a day. I know everybody's got their own things. I don't know if off the top of my head, what is puppy culture? Aren't they like 3 times a day, 4 times a day? Yeah, 3 times a day. So everybody's got their own system. I love it, just as a side note, I love the puppy culture system. So if any of you guys are interested in that, I'm sure there's probably some other breeders that you know that use it that could help you. But if you need any help finding that information, just let me know. I don't subscribe. I actually have the book that I ordered one time, and I've never actually used it to its fullest, you know. I kind of have the same system. I really like the enrichment ideas that they provide. I like some of those types of things. That's really what I've gathered from them the most. Note the eliminations on these puppies. So are they pooping? Are they peeing? If they are not, it is your job. Every time they nurse, they need to be allowed to urinate if they so choose, or defecate. So it's really easy to do that. You just take a moistened, warm cotton swab on both spots. So if you're female, it's really easy because you kind of stay in the same area code. If you're male, you have to go from the prepuce down to his anus. They're not going to poop every time. I don't know how many times I've had owners just stress that their puppies are not pooping every single time they are stimulating them. That is totally fine. Don't worry. A lot of times it's, we haven't seen poop in days. It's because your dam is doing a great job. She's doing it for you. It's not because your puppy is secretly constipated and full of feces. It's fine. Outside heat sources for at least the first 3 weeks, that's especially important relating to herpes virus, since they cannot thermoregulate until 3 weeks of age. So if they're screaming, what does it mean? Your guess is as good as mine. Are they gassy? Are they cold? Are they hot? Did they get stepped on? Are they hungry? Are they busy? Are they mad? Do they have herpes virus? Could be any of these things. So I think you will get better at knowing your own puppy's cries. It's just like a mother with their baby. Sometimes you can tell the difference between these cries. These herpes cries, they are very distinct. And when you know a normal puppy cry and then you hear that puppy cry, it's a very different sound. It's like almost like an agonal moany kind of sound these like septic, really sick puppies will make, versus the I'm mad, I'm cold, I'm over here, I got lost, I'm stuck behind my mom. Those types of cries tend to be more vigorous and clear in my hands. So when you find a puppy that you're a little bit suspicious of, that's not gaining weight. So say you're weighing and having some struggles. So like we talked about, only after the colostral window, we want to actually be using milk. I know this is going to blow some people's minds, but I'm going to tell you to use canine supplementation, not goat's milk, not something that somebody said to make that has mayonnaise and all sorts of things in it. It is balanced and built like dog's milk. That is why it is effective. The other things might work in some situations, and they might have helped a puppy that you've had in the past, but just know those things are not made for puppies. Puppies aren't supposed to eat mayonnaise, right? So, but they are in a high fat milk, so I think that's why it works. That's why some people will see that type of system work. There are hundreds of formulas out there. I mean, people used to make them, right? Because we didn't have this. So like 40 years ago, that's what we had to do. We had to go to the store and make it up. Or go to the neighboring farm and get goat's milk because we didn't have anything else that wouldn't cause our puppies to blow with diarrhea. So I usually, to reduce the diarrhea, no matter what you're doing, just like if you switch your dog's food from one food to another and they can get sick from that and have diarrhea, it's important to stage this in if you can. The easiest way, though, I think, to reduce that diarrhea is diluting it a little bit with water. So the first few feedings, diluting it helps. It will dilute the nutrition. I mean, that is true, but it's going to make it less likely that that puppy also has diarrhea. I also like to add a probiotic. I like to add, there's plenty of powdered probiotics that you can just add to your formula. So that's one way to do it. I also love propectolin gel. So you can't, propectolin gel has pectin in it too, and pectin will help in addition to the probiotics that are in it to help kind of bolster the gut and help the stools to be normal. So just odds and ends there. So this is just so you can see comparisons of what milk makeup is like. So this is more dilute up top to more concentrated on bottom. Humans are around here too. They're pretty concentrated as well. Dogs are 33% protein and 42% fat. Goats are 27% protein, so not far from the protein, not nearly as fatty as dog milk. So I think it's just important to review. We are using it because it makes the most sense for what we have available. And a lot of times that's what we used to use because that was the thing that made the most sense. The reason that we've used it is because it does not cause that diarrhea because of the globule size. So there is a, somebody that looked in the size of the actual milk particle is why you can feed goat's milk to anything, even if it's not made right for that species. Almost no species will react to goat's milk. But if you feed cow's milk, I don't know if anybody's ever tried that with their puppies, but you will cause diarrhea. Holy heck. In a pinch, I mean, maybe this is what we have. So depending on where you live, what you have available. I mean, this went off the market for a little while, the cans especially. These cans are really hard to come by. We started kind of hoarding them, I hate to say, and not selling them to the clients because we couldn't get them for our puppies in a hospital. The powder is pain. So this Espelec powder, or canine milk powders, they don't like to suspend well in water. I don't know if anybody sat there and tried to mix it up. Does not like to. But these cans are already pre-mixed and they kind of pour just like milk would. So other note about goat's milk. So raw goat's milk, if you are a raw goat's milk person, I would encourage you to read into a disease called Q fever. It's an outbreak disease that affects humans, dogs, and plenty of other species. It has to do with raw milk. So it's goat specific because goats are higher shedders of Q fever. But I can tell you when I worked at UC Davis, they actually fitted, now that everybody knows what an N95 is, they fitted me with one of those hazmat level N95s in case I ever was to come in contact with a reproductively active goat ever on campus. I had to do like the fit test and they had me run on the treadmill and all that. Because it's aerosolized, contagious. Obviously, if you pour milk and it splashes, it's aerosolized. We don't want that for you or for your dogs. So just be very careful. If you've used it in the past, you probably just haven't run into it because the area farms that you have probably just aren't having problems. But especially like California would be like big red flag in particular. We have lots of Q fever in California. Yeah. I know, it's kind of a cool slide. I didn't make that chart, I will say too. Everybody got your picture? All right. Okay, so when you're prepping the formula, this seems simple. If you've had a human baby, you probably already know all these steps, but should be slightly warmer than your hand. A lot of people will use the back of their arm right here to kind of test the temperature. You can use one of those little heat guns too. So if it's like something like 97, 98 degrees, that's perfect. I use a coffee mug in the microwave for 5 seconds. That's my favorite way to do it. That is how I was taught. It's always worked. It's not long enough that you're like boiling the milk, right? It's just getting a little bit warm. I'll just put my finger in it. Is it warm enough? If I put a lot of formula in there, I probably need to touch it for a couple more seconds or something like that. But you just kind of adjust it until you need. And warm only what you need. So don't warm up your whole Espelec can. Just warm up a little bit in a coffee mug that you're going to use, either drop into a syringe or put into a bottle. And I guess you could be warming these in a bottle if you're bottle feeding. You can freeze formula to help it last longer. Use an ice cube tray. It'll help you a lot. So those ice cubes will just be little aliquots that you can pull out of a bag. It's much easier than trying to break a piece off out of the frozen bag. And for volume, the bottle feeding puppies, you're just going to want to track their amount. So make sure that they are getting enough. So you know how many ounces based on the tube formula, generally how many ounces they should be eating. If they're eating more, great. If they're eating less, we need to probably switch the type of approach we're doing. Never feed cold milk. Cold milk does not like to digest. It often will curdle in their stomachs. And if you feed a cold puppy, same kind of problem. So a cold puppy will not digest and things will just sit. Their stomach acids will cause it to ferment and they'll get this kind of cheesy kind of consistency that they cannot pass through. They can't digest it and they'll get sick. All right, so there's a few different ways that you can approach the supplementation itself. Bottle feeding, so low flow nipple, or one of the tricks that clients have taught me is human nipples from their own, like that they've kept from a pregnancy that they had or their daughter had. It's amazing how many puppies will not take a fresh nipple, but they will take a broken in one. Whether it's broken in by the right species, they don't care. Low flow just helps so that there's not like extra milk that just kind of gets down the wrong pipes, if that makes sense. Helps with the suction. Bottle feeding's great for large litters. So if you just have like a bitch that just doesn't have enough milk for them to keep up with, this is great to supplement and add in. Rotate your puppies, so don't just be bottle feeding this set and then let the other set be on mom. I think it's good for them to continue to be rotated onto mom. Tube feeding is going to be the best for struggling puppies, so puppies that are not coordinated enough, don't have good suckle responses, are weak. It is the safest. I know everybody likes to debate on that, but basically you're more likely to have a puppy that aspirates from a bottle than you are from a tube if you know what you're doing. If you feel comfortable, if you kind of go through the processes properly. There's lots of great videos. I have one, and I think we have time to play a little bit of it. There's a video posted that I think it was like Revival Animal Health. I think it's Greer. It's Marty. Yeah, Marty's video. That's the one that I usually have people look up. There's lots of poorly done tube feeding videos by like bulldog breeders. So just beware. There are videos of puppies being held like upside down while they're tube fed. There are videos of weird positions. I like to hold them against the table, which is kind of how Marty does it on hers. So I place the tube, I hold the puppy with, one hand with like my fingers pinched over the tube, and then hold the head still, and the puppy will be like, no, the whole time. And then you take the syringe with your other hand, and then you express the milk. It goes into the puppy over 10 seconds or so. And then you kink the tube and remove it, and that puppy is usually really still and happy to cooperate. Sometimes if they're happy puppies, if they're active puppies and they really don't need to be tube fed anymore, they'll resist you to the point where you're like, maybe you don't need to be tube fed anymore. And maybe you're nursing enough on mom. It's kind of a tough call sometimes. It's like, how much are they getting from her if they're still kind of commingling with her, but he's not gaining? So just be careful with amounts and things. I know we talked about 1 mil per ounce of puppy weight. So if you have a 10-ounce puppy, it's going to be 10 mils of fluid. But if he nursed first and had 5 mils in his stomach before you tube him, then obviously 10 mils is going to be too much for his stomach. So just be careful. If you see any kind of flow back or anything coming out of the nose, stop what you're doing and just go slow when you go, so that if that happens, clear their mouth, wipe them out, grab your little bulb syringe or your dealie if you want to. Makeup sponges. This is like the hot thing. Everybody wants to use makeup sponges. Makeup sponges are sponges. They're full of holes, right? So they do passively, they hold something, so it does make that convenient, and they do like to chew on them. I don't doubt that the puppies can effectively get formula this way, but I don't think it's any safer than syringe feeding them. So in the same way, syringe-fed puppies can chew on the syringe, but still drink what they're being made to kind of eat. They're just not coordinated because they don't have suction. So the suction is important to keep things from going in the wrong spot. Doesn't mean that's, if you are in a place where you don't have a tube and this is all you have because the puppy won't take the bottle. I mean, sometimes you got to pick what you got to pick, right? But I think as a primary choice, I find a lot of people like the makeup sponge because they're afraid of the tube. But once they know how to use the tube, then they're very comfortable and happy with the tube. All right, so positionally, so we want these puppies to be kind of like they would be on mom. Now I know there's puppies that will be completely upside down the whole time they nurse, like that one puppy that's always upside down, right? And she's fine, and she never aspirates. But it's good practice to put them in like sternal recumbency, so they're gonna be on their chest with their head kind of forward and actively nursing on the bottle. Now, one thing I will say on this puppy, so if you notice, look where the air is. So that bottle should be tipped up enough, or this better would be if this was an angle nipple. So if it wasn't straight off the bottle, it'd be easier to position that puppy without having to tip his head up in the sky. But we don't want him to suck in a whole bunch of air. That's not helping anything. This is a very fat beagle puppy. So this is approximately, so the last rib is where we want the tube to reach. So what we'll usually do, everybody's got their own way of doing it, but we'll usually use a red rubber 5 or an 1/8 French is usually the size diameter. It kind of depends on the size of the puppy. Most Doberman puppies, I'd say an 8, even a newborn. And basically you're going to pass that, or put the tube over the puppy, lay the puppy on the side, if you're tubing multiple, just kind of make an average in your mind. And then mark the tube here, I usually mark it with a flag of tape. I like that because then I can hold on to the tape instead of trying to hold on to the tube. It gives me more thing to hold on to. Some people just like to mark it with Sharpie. I worry about like the Sharpie coming off, then I have to remark it. I like the tape thing. So, all right. So I have let me see if this will play. I don't know if it'll project. It may not. If not, I'll just tell you how to find it. I have a feeling it's gonna like need it to be in presenter mode, but maybe it'll work. No, all right, sorry guys. So there's a great video. It is on, if you put in on YouTube, tube feeding puppy, it's the first thing that comes up. It's Revival Animal Health is the company that that made the video, and it is Martina Greer, who is a veterinarian and corgi breeder from Wisconsin area, I believe. Anybody know Wisconsin, right? I know Marty, I just can't ever, I know it's terrible, right? I'm from Texas. I can't ever decide, like if it's Michigan, Wisconsin, or Minnesota, if you practice there, I can't remember which one of those states. You could all be in the same spot. All right, so early signs of illness. So if the weight on that puppy that you're focusing on is static, meaning it's not moving, that is a warning sign. That is not a normal puppy if he's not gaining. If he has lost, that's a more obvious sign to an owner. So most owners will, be paying attention, but even just staying the same is not normal. If they're kind of weak when you handle them, that's a really kind of easy way to gauge, is this a puppy that I need to be serious and watch? Or maybe my scale was just off. Is this puppy just like knocking around and super happy? Well, maybe she's okay. Poor suckle response. So we see a lot of puppies that they go on the nipple and then they just sit there. But they want to be there, but they're not nursing. And you like stimulate them a little bit and then they climb and they root around and then they get on the nipple and then they sit there. Can be normal. If they're fat puppies and they're gaining, I'm not worried about that because they're probably just obsessed with being on a nipple. But some of these puppies are just not, they just aren't strong, or there's something just not right about how they're connecting. Omphalitis, this is your bar trivia word of the day, right? I'm just gonna take that one home. That is an umbilical infection. It just means like your umbilicus, your belly button gets infected. So that can be before the kind of dried piece comes away. If you see red, inflamed, it'll look like kind of like a bee sting, like red, thick. They don't usually react as discomfort. They just tend to be kind of red. That is, so in most animal species, the umbilicus is where you get systemic infections. So that's where things go in, where they're not supposed to get in. And things like salmonella or like systemic diseases we think about, and things like foals and calves and things like that. We're checking their umbilicus obsessively. So changes in stool, I think that's one that a lot of owners will catch. Sometimes the owner will only notice a smell. So smell is usually diarrhea or something has changed with their stool. If mom is cleaning it up, but it's still kind of in the air, sometimes some owners will be able to pick that up. It's pretty impressive, I think, sometimes when they do. Because some of these bitches are great at cleaning their puppies. They're great. Urinary character, like color like orange or red all of a sudden, that's a warning sign for me. Puppies don't get UTIs, that's usually like a sepsis warning for me. Sepsis being bacteria in your whole body. Crying, just crying for no reason. We can't figure out why they're crying. That's another sign that we need to be paying attention and potentially acting. All right, so first, at home, we're gonna monitor more closely. I will probably just prophylactically give my puppies Gas X because it's not gonna hurt anything and you can get it over the counter. Usually just a drop in the mouth every 2 hours or so is an option. That is gonna help if this is colicky baby. So if this is a gassy belly, maybe this puppy was supplemented a little bit of canine milk replacer because we were trying to kind of top mom off, but this puppy got kind of gassy over it. Well, that can help that puppy a lot. If we're not already supplemental feeding, obviously we want a supplemental feed to get them to gain weight. I am, again, big fan of probiotics, so I don't think nothing can be hurt by a probiotic. Giving them a little propectolin is not gonna do anything wrong. And we want to keep them in a really warm environment, so be very aware of their temperature, make sure they're not creeping off into a cold zone and just staying there. Potentially we can pull them off and out of the group and put them in an incubator if you need to. Oxygen support, I think it depends on the owner. If you have oxygen in your house, be very aware. I'm sure if you guys have it for your own purposes, you've been kind of cautioned by your doctor about the safety, but those things are basically rocket launchers, so just be very aware of like the tank that you have and where it is, and that it's fastened to the, you know, the wall or to a cart of some kind that's kind of that's safe. But I do think some of these incubators will have oxygen capabilities, which is great. So they can actually put oxygen into their immediate environment. It makes it much easier. You don't have to sit there and like supplement that puppy's oxygen. If they're still struggling, we might take some other steps at the hospital. So we can potentially do this at home too. So sub-Q fluid therapy, some owners will have a bag of LRS or something like that at home. There's not really a good system as to how much and when. It kind of depends on how dehydrated your puppy is. A lot of puppies are not that dehydrated if they're nursing or if they're being supplemented because their diet is liquid. So just be very careful with that. As far as fluids other ways, so we can, depending on the age of the puppy, the size of the puppy. So if this is a 2-week-old Great Dane puppy, I can probably get an IV catheter in that puppy. If this is a 2-week-old Chihuahua puppy, I might still be doing an IO catheter, so the hip catheter. I am a big fan of using fresh frozen plasma in the midst of any mysterious, I don't know what's going on with this puppy. We don't really know if that's helpful or not, but again, it's probably not going to hurt. Just be aware of where you've given, when and where you've given fluids. It is fluid, so they are going to process it as such as well, and the liquid component. Antibiotics, a lot of people will keep some Clavamox drops or clindamycin drops at home, or have gotten them from your vet. It's interesting, there's a lot of talk with the internists in veterinary medicine about we should be using a different route of administration, that the oral antibiotics were creating more resistance than if we use injectable. So it sounds a little bit odd, but there's an injection that's really made for cattle that a lot of the internists are starting to use as once-a-day sub-Q injections that they'll give for their owners to give at home if you're comfortable. So just heads up in case that changes. So if your vet starts recommending that or brings that up, it might be something that, that they had picked up at a conference or had heard about. We're just, especially on the internist side of things, I mean, they're dealing the most with resistance. So they're dealing with all the crazy infections. Well, they start here when we start giving antibiotics when they're this old. So I think, I'd like to be able to use Clavamox for adult dogs, and if I'm creating resistance as puppies, maybe it is a better idea to use cefazolin or something else injectably. They are tiny patients, but we can do x-rays. So sometimes there is something wrong that we can find. Sometimes there's something on blood work. I know they're teeny tiny, and your vet's machines may or may not be able to run teeny tiny samples, but a lot of the blood machines that are out there can actually run on very small amounts now. So it might be possible to look at blood work. Urine we usually just use, we won't get enough to be able to do much with other than assess for like concentration. They shouldn't be very concentrated, so a normal puppy should be pretty dilute. And we can look for things like crystals. Not real common for that to be a problem, but potentially might be a way that we could assess or culture for like a septic puppy or something like that. All right, fading puppy syndrome. So how many people here have heard this phrase? Everyone, right? So fading puppy syndrome, depending on who you ask, basically has no definition. So it includes everything. Basically, any sick puppy that's not doing well is a failure to thrive puppy. So it's not really that helpful for us, as far as being able to figure things out. They could just be poor doers. They could have an infection. They could have herpes. They could have parasites. They could be dehydrated. They could have fleas. They could be a lot of things. My very first fading puppy syndrome consult was after a bitch lost a litter of 4. It was maybe like a Sealyham Terrier. No, it wasn't. It wasn't a Sealy. It was the little blue ones that have the funny top lines. not Bedlingtons, short Cheskies. Chesky Terrier, so very unusual terrier. She came in with this Chesky bitch and said, my bitch has allergies, but she just lost, I wanted to come to you because she just lost this litter, and we don't know why. Cheskies are dark bluish color, usually, and their puppies are born pretty much black. And this owner is not well mentored, and she's the only, I mean, there's not a lot of Chesky people around, right? So like most of her mentorship is at a distance. She didn't have a vet that she was comfortable with. I had just moved to the area. And she came to me and just said, I want to understand why my bitch, is there any way I can figure out why my bitch lost her 4 puppies? Because they all failed to thrive, and we don't know what happened. And we talk about the bitch's allergies, and guess what? The bitch is covered in fleas. Those puppies were probably anemic because they were bitten by fleas until they were anemic, and then they got quieter, and then they started looking like fading puppies, and they started doing all the fading puppy things, and it didn't work because she had fleas. So just know, I mean, it's kind of a blanket term, so it can be a lot of different things. It's just a matter of trying to rule out the things that you can understand. Obviously, husbandry you can control, and then trying to sort it out. Sometimes it's postmortem is when we figure it out. So if you have a fading puppy, supportive care is our approach. The things we've already talked about: supplemental feeding, giving fresh frozen plasma, hydrating them, administering antibiotics, maybe antivirals if you're on the herpes strain. I'm not actually an antiviral pro person, having dealt with the litters that I have dealt with. Heat supplement is completely eradicates herpes virus, but if you had an active puppy that you felt like, if you had access to acyclovir and you get to it that quickly, I think usually we can't get to it fast enough for it to make a difference. But perhaps some of the clinics you guys visit have access to those more quickly. And of course heat support as well. All right, so briefly we're going to talk about herpes virus. So very common disease of dogs. It is considered ubiquitous, meaning it is everywhere. It's in all of our show dog populations. It goes to dog shows. It's all around you. Almost every dog that you own probably has a high titer to it, unless she has been secluded in your house, maybe from COVID. I didn't really see an uptick after COVID, but just the isolation of it all would lead you to potentially being concerned for this. Basically, it's kind of like the chicken pox concept, where if you've been exposed to it, people sometimes purposefully expose their dogs to other dogs just because they think, okay, well, she's more likely to have a herpes virus titer, she's more likely to be more healthy going into this litter if she's kind of been commingled with all the other dogs instead of being isolated. Once they have exposure, in theory, they should be protected for the future. So it's just the completely naive bitch that gets it when she's pregnant that's the problem. So for adults, they might sneeze once. That's their clinical sign. So you never know they have it. They're fine. Puppies will have either litters that resorb. Sometimes they abort litters with this. Sometimes they have a high rate of stillbirth. So maybe your vet ultrasounded and she said, oh man, this bitch is full of puppies. She's got like 12 puppies in here. I can't even count them all. And then you come for your x-ray and there's 5. And then you whelp and 2 of them are stillborn. That's the kind of pattern that would fit with this. More common though for it to be stillbirths and early neonatal death, because it tends to behave more so as a exposure in the last 3 weeks. So the concept is if she has been exposed before 3 weeks from her due date, then she has had time to make antibodies. If she didn't have time to make antibodies, then her puppies don't get antibodies. So then those puppies have no protection. But if she has the antibodies, they're protected, they're fine. So as long as they absorb colostrum, as long as all of those things are checked, then we should be fine. Unless they can't make those antibodies, and then you think that they're okay, but maybe, I think the common mistake people make is they have 3 bitches in their house, and they take the 12-month-old bitch to the dog show a week before their other bitches do, and then they bring her back home and she commingles, but they're kind of segregated, but like they'll touch noses, but the one bitch is in, she's really been moved to her like whelping area. Still can happen, so still transmit. It will transmit when your dogs touch noses walking by the ring side. You guys keep really good control of your dogs, which I really appreciate. It's so nice, but even just think, Judge goes into this mouth, comes out, touches the dog, watches your down and back, goes to the next dog, opens the mouth. That's why there was, well, this is one of the reasons why there was a trend toward judges not opening mouths themselves for disease transmission. So, okay, so it is a latent virus. So herpes virus, just like people, so you can come and go and have cold sores, come and go and come and go. It doesn't behave so much like that, but it is still that family of viruses. So every once in a while, this virus will go dormant, and these bitches will have this happen recurrently. But for the most part, once you've had it happen, it will never happen to her again. And usually it will not happen in your kennel again for a while because they're all exposed to each other. All right, so we already kind of talked about this. Sorry, I got a little excited there. So the critical time frame is from the last 3 weeks of pregnancy to the first 3 weeks of life. So that 6 weeks, she should be pretty well isolated, or your home should be kind of isolated from comings and goings. So no, like, your mom brings the bitch that is from your breeding program, but she's going to Hawaii for a week and she wants to bring her dog and she does obedience. Nope, not a good idea. And she'll understand. I mean, this is potentially you're losing the entire litter and sobbing. Some of you guys probably have that experience. It is, I mean, it's horrible. You can't, some of these litters, we lose the entire litter. There's nothing we can do. So we can titer. There are some people who titer obsessively. And I love you guys. I don't titer my own bitches because I just assume I want to trust it, but I will still behave the same way. I will still prevent her exposure. I will still not take her to anywhere. I will still assume that maybe these puppies won't get colostrum. I will still keep them in a heated environment. I mean, I'm still going to manage them that way. So it is interesting medically for us to know if your bitch is naive, you need to be way more aware. If she has no titer, that means that she is at high risk if she does get exposed to having this problem. But I just think that, you know, it has limited application for us. Okay, so classically, how they'll present. So multiple stillbirths, like we talked about, potentially, or puppies are born, it's usually like the biggest, strongest, like he was a hoss when he was born, he was 18 ounces. And then he, nurse is great, and then like 3 days in, he's like crying, and he's big, but he's crying, and he's crying, and he's crying, and he won't right himself, and he's mad, and you pick it up, and you try to comfort him, and he won't stop being mad, can't get him to nurse. He usually within about 24 hours of showing that type of sign, they will be dead. So usually they will die naturally, miserably. Sometimes we don't know what's going on at that point because usually the first puppy, it's like ground zero. We don't know what's going on yet. If you have multiple puppies that start to do this, usually every puppy that is already vocalizing and acting weird, those are all going to die. The ones that you are focused on, you're trying to save the ones that are not clinical yet. The clinical ones are going 99% of the time, they're going to be lost. Sometimes we can save them, but I think more often than not, if that's herpes virus, the damage is done. So diagnosis, we base on history and symptoms. So if they're acting like herpes virus puppies, I'm going to have you keep them in much warmer environments, and we're going to change how they're being housed. We can do what's called convalescent titers, which means we had an old titer. So if you had a titer that was negative, and then you, when she's a week postpartum or so, you have a puppy that starts screaming like that, well, you could draw and send off for another titer. By the time you know this, it's just going to be like, gee whiz, we confirmed it. It's not going to be that we're going to be able to fix things. Because those titers don't come back tomorrow, and you got to ship them off, and then they got to read them. It's not an instant turnaround. We diagnose this on necropsy. So usually the puppy that dies, we want to look at it. We'll usually do just like a standard lateral necropsy like we would on an adult dog. But what we were looking for is we were looking at their kidneys. So they had these very characteristic little hemorrhages on their kidneys. They call them turkey egg kidneys, if you want another beer trivia fact. But basically these kidneys are very, very pathognomonic, meaning this is what they are when we see kidneys like this. So how do we treat the ones, if we think that this is herpes virus, how do we treat the puppies that we have? So warm environment is the way to do it. They will be mad. They will not be happy in their box. It takes a while for them to get used to it, but basically we want to make their body temperatures higher than it's supposed to be. We want to make it higher than 99 degrees. Normal first week of life is 95 to 97, so those puppies are not going to be happy being that hot. I think these are puppy, let's see, what are they called? This is a company that makes incubators, and the name escapes me, but I can get it for you later if you're interested. I just can't, it's escaping me right now. But human, like reusable old human incubators, and there's lots of ways that people kind of create incubators. I actually had a client successfully have a Labrador litter with a herpes viral infection and saved some of her puppies in a container that was just like an igloo thermos like that. She didn't close the top, right? So she put a heating blanket on the inside and just like had a heat thermometer and just made sure that like the temperature was right and was able to figure it out. And she didn't have very many puppies at that stage. She was the classic, had 10, then x-rayed with 6, then she had 3 stillbirths, but they missed the first puppy's birth. These were real novice owners. They didn't know what they were doing. Was it their choices as far as how they were whelping? Was it just chance? I mean, we weren't really convinced at that point, but then once she started having puppies drop, it was very clear. Again, antiviral therapy, depending on who you ask, some of us will include this. In theory, acyclovir can be given and helpful, so it limits virus replication. We don't actually know if it's really effective or if we're really benefiting. We're not doing just antiviral therapy, so we don't know if we're really just benefiting with the heat versus the antiviral therapy. Antibiotics, these are stressed puppies, so I am a fan of giving them antibiotics. I know it's a little bit debatable, but every once in a while these herpes virus puppies will look like septic puppies and we can't quite decide which ones they are. So sometimes we'll do that. Fluids, so they're in a hot environment, definitely going to be a little bit more dehydrated or lending to being more dehydrated, so just watch that. And FFP, again, I don't think that there's any reason that we can't use it just to boost them. Maybe that FFP will have some. We don't know if the FFP that's out there circulating will actually have anything in it to benefit us, because those dogs aren't tested. They're tested for their blood type. They're tested for all sorts of viral things, but not this one, as far as the focus. And if your bitch has this occur, it is almost zero likelihood it's going to happen to her again the next time you breed her. I think people freak out and they're like, I don't think I want to breed her ever again. It was so traumatic. But usually the ending is very happy. They go back, they breed back to the same dog. They have a wonderful, successful litter and have no problems. It's just a matter of changing your exposure practices. Sometimes it just happens no matter how careful you are. And there is a vaccine, so just wanted to mention, if you have a problem recurrently, so if you have this like latent carrier comes back and haunts you kind of scenario, or maybe you had a large kennel, had several bitches affected, it was just a nightmare, you can actually get a special permit from the USDA to get this vaccine for your bitches. They use this, I think it's a serial vaccine that they use like a couple months before breeding routinely in Europe. Why don't we have it here? I have no idea. But we can't legally, so you can't go, well, I can't go as a veterinarian, order this and just use it however I want to, because it's not labeled as an FDA approved drug. It's FDA. Yeah, it's just the lovely paperwork of making sure things are safe that come to the US and do we trust it and all of that. Yeah, it's just tricky. But like I said, if you have a history, we can order it, technically. They do have these permits for it. And then this is kind of a basic thing, but just remember necropsy has its place. I know it's very emotional sometimes to understand what happened to your puppies. Sometimes you know. I mean, if you know what happened, then you know. But if it's something where it's this kind of weird, mysterious, we don't know what happened, I think it's good to know that information for the future. It helps you become a better owner, even if you're just aware of how that puppy died from a presentation perspective, even if there's nothing you could change. I think it's good information. It's just hard when it's happening. It's so emotional when it's happening.
Can you clarify the fridge versus freezer?
Yeah.
Oh yes, good question. So fridge versus freezer for necropsy. Fridge, always fridge. Always fridge. If you can, overnight that puppy. Most puppies are small enough you can put them in a small box and overnight them to a diagnostic lab. Most of those university diagnostic labs will answer their phones around the clock, so they have an emergency line or a poor resident that gets to answer the phone when somebody calls and says, I found my cow in the pasture. So same thing, they can tell you, okay, well, we're going to be open at 9. If you send it today, we will process them the following day, so we'll be able to tell you, in 2 or 3 days after that. They'll be able to give you information, but freezing kills the integrity of the, or not kills, it changes the integrity of the tissue. We also don't want the puppy, we don't like to put the entire puppy in formalin. Like if we have a puppy that dies maybe at the hospital, we'll still want to send it fresh on ice versus doing any kind of formalin fixing. You might be able to do, if your vet does necropsies regularly and takes biopsies for you, they could do that, and that's going to go in formalin, so the little pieces. But as far as the pathologist looking at an overview, that's going to be fresh, chilled tissue. So they just keep things, usually things keep for 48 hours or so, as long as they're cold. A couple of days, they can still have great diagnostic value. And it's much better value. So if you guys have ever sent in if you had a bitch that aborted puppies and you sent off an aborted puppy, those have very low yields for diagnosis. These are excellent for diagnosis because these are little dogs. So they really can do a thorough assessment on things. And again, I think it gives you good kind of closing state of mind on things, just to make sure that you know what happened, this is what happened, I feel good going forward, I don't need to change anything that I'm doing. All right, so basically overall for these guys, just keep an eye on them, be very aware if they're static on their weight, be very aware if they're losing. Supportive care, some things can be done at home if you're comfortable and if you've got a good relationship with somebody who can supply you some of those things that you need. And don't hesitate to act soon. It's never wrong for you to bring me a puppy and say, I don't know what's wrong with this. Sometimes that happens where I have to trust that you're right, that there is something wrong, because it doesn't look like the videos you're sending me are wrong, but just weird stuff. I had an Australian Shepherd litter that I managed for somebody, and she had 3 puppies that she was sure had no riding response, and they were acting neurologic from birth, and she was like, there's something weird with these, there's something weird. Well, this particular breeder had kind of gotten out of working bred type Aussies, and this was her first really show bred litter, and I'm like, they're not going to be these obnoxious urchins that the working dogs have. They're going to be these fat panda, fun puppy. That's what they are. Show Aussies are oh. So I just thought it was just the difference of how she was interpreting that. No, she was right the whole time. Those puppies I saw them when they were 3 weeks old. I just told her there's no way, they still couldn't ride themselves. She had weaned them. She had tubed them and she had weaned them, and she would place them, but they couldn't quite stand to eat. They couldn't function, and they weren't getting better. Sometimes neurologic things just get better, but they weren't going to get better. So it was a weird manifestation of parvovirus, actually. So it's a good example of when she sent, we picked the sickest puppy, and the intestinal lesions fit with a parvovirus exposure, likely in utero, that affected, they think their proposal was that if we had tested their liver values, that their liver values would have been super high, and that was causing them to have weird mentation changes. They didn't have seizures, so that's the only thing I was I would think if they really had hepatic problems that they would have had seizures too, but maybe they weren't, it just wasn't as overt. But they were definitely, the whole time, they were just neurologically abnormal. But she was worried. She was like, okay, it's something in my environment. She just moved to a new home. It was the first time that they had used that stud dog. They were completely freaking out. And since they knew that, well, she vaccinates for parvo. She lives in Oklahoma. We live in an area that's very endemic with parvo. There's no way that you can completely prevent your dog from being exposed, and it was probably just a fluke thing. Not what we were expecting. I was hunting for Neospora is what I was hunting for. I thought it was going to be something focally neurologic that only affected some of the puppies, but that we would still want to know. All right, so time for a potty break, right?